This exercise is a very subtle, small range of motion exercise. It is a supine cross connect where we're using the wall. So you want to have a small bend in your knees, and then we want, ideally you do this barefoot, but what we want to feel is that big toe and that inside part of the heel are pressurizing that wall, right? Or we're pushing into the wall with those two structures in like, primarily that's where we're feeling it in the foot. I don't want you to feel the whole foot. I definitely don't want you to start pushing into the outside of your foot and twisting at the hips. Like, we want to feel this pressure in with that big toe and the heel. And you can always have something resting underneath your head or underneath your neck, especially if we have neck considerations. But primarily this is about the hips and the pelvis. So what this is doing is it's just making sure that we're doing a pelvic tuck. We're setting a neutral pelvis without tucking and really overly bracing with the core and the abdominal muscles. That's gonna kind of train us into this like pull down, compress the anterior lower rib cage, just be really stiff and rigid here. And we're just stealing external rotation and finding external rotation out of the back when we want to create this ability for the pelvis and rib cage to move independently, right? So we'll see here in the second position is you're creating that pressure with both your feet and your heel. Now I'm gonna go right elbow, left knee, and now we really want that pressure there, because as I'm coming up, this pressure with my right foot should be keeping my pelvis in this neutral tuck position. And then watch what we do with this knee. Like, we don't want to drift it out here. That's you cheating and trying to use external rotation. And we don't want to drift too far across the midline. You may feel a pinch in your groin, but that is trying to steal too much internal rotation. So we're really just trying to stabilize here. And then we're keeping the palm facing the face. And we're reaching that torso, that rib cage should be compressing on this side and expanding on this side to help us get here. We don't want that whole body rotating. So if we really start to twist, it's not a bicycle crunch. This is just the ability to compress one side and expand the other. And now we breathe. So finding this position and breathing. You can have this other arm out to the side. Remember, keep that toe and heel pressure. You may notice you get really shaky with this. That's because your nervous system has not really remembered how to use this well. We're just trying to wake that pattern back up and get conditioned to expanding the rib cage and compressing one side and regaining the endurance and the ability to do this. You can also trap a foam roller between the knees if you need that, just to kind of help. Like if you're getting stuck here, that's fine. Just trap a yoga block, a foam roller in between here. But we really want this ability to just get to this position. Breathe in and out, somewhere between 6 to 8 breaths. Then we just swap and we go to the other side. And you may notice on this opposite, ideally if you have a wall, it's better than a garage door. But you may notice on one side it's much easier, right? So for me, it is much, much easier to go left shoulder, right knee, and compress my right rib cage. My left side is much more difficult. I get way shakier, way faster. Inhale through the nose. Soft exhale through the mouth. We're not trying to force air out. That'll force you to contract your abs. We don't want to contract the abs with this. So this is a supine cross connect with breathing.